what about the choice of your dream specialty in US, in UK and in Australia? Is that really possible? Becoming a doctor is like no other profession. You spend 5 years developing core clinical knowledge during your MBBS. Then minimum of another 5 to 6 years of postgraduate medical training to become an orthopedic surgeon, an emergency physician or a psychiatrist. So I'm not wrong in saying that 5 years of MBBS and 5 years specialization are both equally important in medical career. Now, when I left Pakistan 23 years ago, I had only one target in my mind, which was to do postgraduate medical training. I'm going to talk about doctors in any country who would like to know if they can pursue their dreams of becoming an orthopedic surgeon, anesthetist, dermatologist or radiologist here in Australia. Yes, you can. And the most beautiful part of this journey is that all it requires is hard work. And that hard work actually starts when you come here in Australia. For ease, I'm going to divide this conversation into why medical training is important, key requirements to start medical training here in Australia, easy versus hard medical specialties. Now, there's a bit of a debate in there. Salaries during your training, postgraduate clinical exam, family life during training, top 5 tips, and finally, I'll lay out my conclusion for you to make up your own mind. Now, why is training important? I'm helping lots of specialists from India and Pakistan, as you may have noticed on my website www.emergencyfocus.net. Now, these are the specialists who have completed their MS, MD and FCPS training programs back in India and Pakistan. Now, in Australia, a well-trained specialist can apply for specialist pathway registration without any further exams. And if they're found to be substantially comparable, now this is perhaps the best news they could receive. That is the accreditation of their training and exams from Pakistan and India, and now being tested alongside US and UK doctors who've completed their Certificate of Completion of Specialist Training, or CCT as it's called. Now, for the doctors who have done Caesar pathway and then have obtained FRChem, FRCS, MRCP, MRChem, MRCOG and rest of the membership exams or even fellowship exam through self-constructed training, they are not currently acceptable to apply for specialist pathway. Now, one may ask that they have the same exam as the UK trained doctor, but the crucial bit is essentially missing from the equation, which is the structured training. Now, you may say that from that point of view, FCPS in Pakistan and MD and MRS India do actually carry more credibility compared to Caesar pathway from that in the UK. So in essence, the training programs from the subcontinents have equivalent credibility to that of the UK CCT. Make no mistake about it. But that's not all. A medical training, no matter where, it provides an affirmation that the specialist doctor have achieved a substantial knowledge, clinical skills and communication to practice independently. Now, key requirements to start training here in Australia. It is a fact that not all doctors will be able to start postgraduate training in India, in Pakistan or other developing countries simply because there are not enough training jobs. And that is why we see doctors appearing for USMLE, PLAB, AMC and other licensing exams. But what about the choice of your dream specialty in US, in UK and in Australia? Is that really possible? You see, the common misconception is that if someone wants to become a neurosurgeon, for example, in Australia, then they have to have lots of neurosurgical experience, publication, presentation right after their host job. Whilst this is one way of doing it, but I can assure you this is hard and old way of doing things. If you look at the criteria of joining a neurosurgical training program here in Australia, the requirements are full registration, permanent residency, clinical experience in Australia of 3 to 4 years in a combination of RMO and unaccredited, that is the non-trainee registrar, part 1 of the surgical exams in Australia, some courses which are essential on their surgical website, a structured references requirement, and a publication or presentation at a national conference. So my point is, when everything needs to be done to achieve a neurosurgical training here in Australia, then what's the point of doing the whole thing back home in your own country? Then the focus should be to get into Australia, start with any medical job, and then slowly work your way towards your chosen specialty. I would like everyone to understand postgraduate training in Australia is classified as pre-vocational and vocational training. These years are perhaps the best time to broaden your clinical experience in medicine, emergency medicine, pediatrics, ICU. And these years actually give a doctor good fundamentals regardless of your future goals. That is a very common misconception. If I want to become a surgeon, I should never do medicine or emergency medicine or pediatrics for that matter, whilst it's not entirely true. In fact, these strengthen your CV. Yes, in the final vocational years, your focus should be more towards your own specialty. Vocational training years are the core specialist training in neurosurgery, orthopedics, cardiology, or whatever your chosen specialties. Even for dermatology, they would normally require 2 years of general medicine training before joining 3 years of dermatology training program. So my advice for all the doctors wishing to start in Australia is to start broad. More broadly as an RMO in general medicine, ED, ICU. There are plenty of jobs in those categories. And then develop a specific aptitude towards surgery, ICU, radiology, anesthesia. And in those 2 years, find relevant courses and the criteria which are required for you to join the specialist training. You also need to understand the quality network in your desired field. And you cannot do those kind of things whilst you're in India and Pakistan. Now, if you have a passion, then do research, do publication, and also develop a strong teaching portfolio. And I can guarantee no specialist training will be out of bounds for you. Now, there are always going to be some specialties that are going to be more competitive. Neurosurgery, orthopedics, plastic surgery, dermatology. Here I would like to give you an example. If in your own country you are unable to join a postgraduate training, it's because of the same competitiveness, less job and more applicants. That does not mean that you will not get into the training. It just means that you would have to work a little bit extra hard till you improve your chance to get into your chosen specialty. Research shows people who lose out in joining the specialist training program are because of their lack of time organization during RMO years. Focusing on research, focusing on publication, preparing for interviews, GP, ED, psychiatry, and most medical specialties are relatively straightforward to join without needing to do extensive work or publication, research projects, etc. So my advice is, rather than, being entangled yourself and with your family and competing priorities, think twice about your commitment. Also, in government or public hospital, all jobs pay exactly the same. It's actually the private work which takes the cake. Salaries during training. Pre-vocation or RMO year salary is about $80,000 to $120,000 per annum. That's gross, pre-tax. And, it equates to about $6,000 to $7,000 per month post-tax. Vocational or during specialist training, this may increase to about $120,000 to up to $150,000 depending on number of hours you put in and number of out of hours or weekends work that you put in. Doctors do get paid salaries for doing medical training here in Australia. A question which gets commonly asked from India, where doctors have to pay to get into, training programs. Postgraduate clinical exam. It is often said the best time to start planning is from the day one of your specialist training, as most training provides with the core conceptual learning of assessment and management of patients. And the best time to start preparing for the final fellowship exam is in the last 30 months of your training. Do little by little from this point onwards, and trust me, you will have no trouble in passing the fellowship exam. You also get a lot of mentorship and educational support from Director of Education and Medical Training in your local hospital here in Australia, so please avail that. Family life during training. There is no reason except personal preferences when it comes to having a family or not during the training years. Evidence shows that doctors with partners, children and families have better chance of passing the fellowship exam, also scoring higher during the fellowship years. From my own experience, exams and training can often be too lonely. Family is really that unavoidable break that keeps you on the track to success. Top 5 tips. You can start any job regardless of your final specialty of training. In fact, you might add variety to your CV, having ICU or critical care or general medical experience whilst applying for cardiology or orthopedic jobs. Plan every year as you have something to push your CV to a new limit, like a course, a presentation, and that you can easily manage within a 12-month duration, rather than working full piston to get 5 publications, the teaching experience, the mentorship in the last year leading up to the training selection years. Choose a specialty based on your research, networking, and your own aptitude and energy levels rather than be impressed or inspired by a single doctor or a consultant. Surely a person can be a source of motivation, but should not be a sole reason for doing the specialist training. Now live an economical life with time with friends and family and focus on training and exam. The last thing that you would want is to burn out by bills and overburden relations and commitments. Finally, and most important, training must have a component of enjoyment during its course and the sense of achievement at its completion. Make sure you experience both these virtues. So my conclusion is training is possible and there are ways to do it part-time or full-time, and there are more flexible options now. You will find as time progresses that there will be very few doctors who have not trained and specialized in some field as the years go on. Choose your own options wisely, discuss and make a commitment. You've already defied the odds getting into the med school, so why not keep on continuing with that challenging spree? And remember, I'll be doing a live session on how to join training schemes here in Australia soon. So please click on the link in the description to register and join the free live sessions to have a commitment and conversation and discourse about joining training schemes here in Australia. Look after yourself and each other. Goodbye.